Hey folks, Doug Blake with Body Design University, and Merry Christmas. Welcome to another of our weekly studies. Today we are going to actually talk about a subject that I saw in one of the posts just recently. Actually, the student did a good job. He actually videotaped himself, if you remember seeing this, and he was doing the overhead squat assessment. It's actually a really good idea to actually videotape himself and assess what it was that he was doing. So I thought it'd be a good opportunity to talk about very briefly the overhead squat assessment. Now, just keep in mind, when you're going through the NASM textbook, I've said it 1,000 times. If I said it once, there's two things that you really got to be thinking about. One is you have to pass the exam itself. So when you're thinking about the material that you're going over, looking and reading, it can be a little confusing because what you're trying to do is say, from a real world perspective, am I actually going to use the overhead squat assessment? Maybe, maybe not. I don't know. So there's that part of it that folks that do lifting, that exercise, you kind of look and go, well, this actually might be a good thing to do in the real world. And I want you to stop for a second. Yes, you can look at it from that standpoint, but keep focused, stay focused on the fact that you need to memorize the material in such a way that allows you to answer questions on a test. Once you've taken your actual exam and you've passed it, then you can go back, spend all the time you need in whatever business model you're using, whether it's one-on-one training or group training, whatever that is, and then make your decisions as to how you're going to do your screenings and your assessments, even your use of the OPT model, things like that. So just always want to just kind of keep that in mind, that there's two things you navigate when you go through this type of material. It's really good material that a lot of it you can use in the real world. Some of it you may or may not use. It's going to be up to you. And the other is the reality that you've got to pass the exam, and therefore you need to memorize the material. So let's go ahead and get started here. What we want to do is begin with just a brief explanation on the overhead squat assessment. It's normally the first one that you're going to do with any client when it comes to the actual dynamic. Now, remember, there's a static assessment, right? You remember what static assessment is? Basically, you just stand there, you look at the 5 kinetic chain checkpoints, and you go, okay, lordosis, kyphosis, right? Head is jutted forward, whatever those parameters were that you looked at, and you do need to memorize those. And by the way, I will tell you one thing, even though there's lots of charts, what starts to happen is when you look at it over and over and over and over again, it moves out of just this arcane material to you actually start to understand it. And it makes it that much easier to answer those particular questions. And then you get to this dynamic assessments, which is where the overhead squat assessment comes in. And so let's keep this within the framework of what NASM wants you to know. So basically what I've done is I just went ahead and threw up the actual different charts that we have here in this particular chapter. I believe if I'm correct, it was chapter 12 on the assessments, but you can correct me if I'm wrong. And the other thing I'm going to do is kind of give you the idea that when you're actually looking at these charts, kind of like what I'm doing here, I'm going to put a pen up and I want to actually draw this for you just so you get an idea. And I'm just going to kind of circle some of the areas when you're looking at it on the visual cues. So when you're looking at these charts, the very first part that you're going to see is what joint are we talking about? Now, remember, there's 5 kinetic chain checkpoints that you're looking at whenever you do either a static or a dynamic assessment. And so what joint do we look at first? Well, I mean, it's entirely up to you, but when you're looking at the chart that NASM recommends that you use, is you start at the foot and the ankle, and you're going to note any discrepancies. And you're going to do it with the knee and the Lphc, and then if you need to, the shoulder, head, neck area. But in the case of this very first component that you're looking at the ankles, and you'll notice on this chart they have these little lines right here that basically show you where there's going to be a distortion or discrepancy in what it should look like. From a memorization standpoint, it's really pretty straightforward. For the overhead squat, you're looking at a person from the front and you're looking at them from the side. Now, I think the student that actually did this and did this post, he actually turned around to look at from the rear, but you don't have to. It's only front and side. You're really only checking a couple of things to determine if there's any discrepancies in postural deviations, distortions, things like that. So the first thing we look at is going to be the ankle and the feet, and generally the feet are going to be right with the loss of the arch. Right, you're going to have this flat-footedness, and that's basically, or they're going to be turned out, and you're going to see that as well. Normally, you're going to see these guys are related to other issues within the full kinetic chain anyway. So of course, the joint is what? The foot and ankle. That's the easiest thing to remember. There's only two viewpoints. So basically these guys right here are easy. It's not like you need a whole lot of time, and I'm just crossing those out so you don't waste a whole lot of time trying to memorize certain things. Obviously at the ankles can be turned out. They can be either pronated, supinated, turned out, turned in, whatever the case in. But generally, when it comes to the overhead squat assessment, this is what you're going to see the majority of the time, which is that the feet, or even the toes, if you wanted to look at it that way, are turned out. Now, here, of course, is where you spend the majority of your time. And this is where students are always asking the questions. How do I memorize overactive, underactive muscles? And the answer is, well, first off, you got to memorize the muscles. You got to know what the muscles are. And I've said this before on a previous weekly study, which is, how do you do this? Well, the answer is you've got to read it, write it, and recite it. So what I do is I keep bringing this back, and I'll tell you over and over again, there is no magic way to memorize. That's just the nature of the beast. Get a sheet of paper, grab a anatomy picture or whatever the case is, and over and over and over, simply write the name of the muscle and what its kinesiological function is. So overactive muscles, in this case, if you see gastroc, right, the gastroc, what does the gastroc do? Well, the gastrocnemius is a plantar flexor. The soleus is a plantar flexor. So if they are plantar flexing too much, it's going to cause some distortion at the ankle. Now, again, one of the other problems here is that when we look at overactive, underactive muscles, it's really difficult to see the muscle itself doing this action of being overactive or underactive. That's why we look at the limbs and the joints, because it's the limbs and the joints that are out of place that are telling you this muscle is pulling too tight. Now I'll just do this as an aside. If the gastroc, now think about this, if the gastroc, right, let's just say your gastrocnemius, just the muscle itself, and let's just say the medial aspect of the gastrocnemius, if it is tightened by literally 1 or 2 millimeters more than it needs to be, more than its proper operating length is, that's going to cause the distortion. This is why sometimes it's hard to appreciate. When we talk about overactive, underactive muscles, in some cases, the overactive component or the overactive muscle component at the joint is only tightening up. You wouldn't even see the difference in shortening length, but it's enough to create these minor distortions. And of course, as with a couple of these others, the hamstrings themselves are going to be overactive. What do again, your job when it comes to understanding overactive, underactive muscles is to know what those muscles actually do. And the hamstrings do what? They flex the knee, right? Okay, so their main kinesiological function is knee flexion and hip extension. Now, if you're saying to yourself, oh man, I didn't even know that. Well, there you got to go back to your basics, which is you've got to know what the basic kinesiological function of the muscles are. If you know that, then you go, oh, okay, well, the hamstrings are pulling on the knee, you're trying to flex the knee. Well, the gastrocnemius actually helps and assists with knee flexion as well as plantar flexion. If you knew that, a lot of this makes sense. Now, here's what we do is because muscles are overactive, their antagonistic muscles are generally, not all the time, but generally you're going to see the underactive muscles that are antagonistic. So just as you can see, so the underactive muscles here would be the anterior and posterior tibialis. I know what you're saying. How can an anterior and posterior? Well, they have very similar functions outside of their main functions. The anterior tibialis anterior is a dorsiflexor, right? And the posterior tibialis posterior is a plantar flexor, but both of them actually have secondary components kinesiologically, which is going to be either supination or pronation of the foot or internal external rotation. In this case, it's going to be external rotation. So there is part of your problem. And now you're saying to yourself, okay, wait a minute. I'm looking at my foot and ankle and what the heck is the gluteus group got to do with that? That's what you're asking. I know, and you should be asking that. And the answer is really that because of the kinetic chain, it's never just the ankle that's a problem. It's going to be the knee and the Lphc. Now, it makes sense when you think about it from the standpoint of exactly what are the glutes doing, the gluteus maximus and the gluteus medius. Well, if they're underactive, they are allowing hip flexion to occur. Okay. And so if they're allowing hip flexion to occur, that's going to cause issues at the knee, which is why your hamstrings are overactive. Okay. So take a step back. And if you understand, just think about it mechanically. If my hamstrings are able to tighten up and flex the knee, that means that the femur needs to be able to go through extension at the hip easier, so to speak. Hence the reason why the gluteus maximus and medius are going to be underactive to allow for appropriate hip flexion and knee flexion. Okay. Sometimes it's called triple flexion, if you've ever heard of that. So that's hip flexion, knee flexion, and then it would be dorsiflexion at the ankle. But again, if you just want to memorize the muscles, pretty straightforward. So that's a mess that I made on there. So think about that from the standpoint of just looking at the ankle. Overhead squat assessment. Basically, I'm looking at an individual and I'm looking to see whether the toes turn out. Now, here's the other thing to kind of keep in mind. Everything you see here, right, is based off of the ideal position. Okay, so the ideal position of the foot should be roughly straightforward, kind of like that. And the fact that they're turned out, by the way, this could be a pretty subtle issue. And I'm just trying to help you out from the standpoint of what NASM wants you to think. Some people will turn their toes out just ever so slightly, and you may not catch it. It's one of the reasons why you have to do it with the shoes off, so you get a better view of exactly what's happening at the foot. So let's move on from that without getting things too confused. Given that we started and spent so much time on that one, let's move a little bit quicker through the next kinetic chain or checkpoint, which is going to be the knee, right? And you're looking at them from the front. So you looked at the foot, now you're looking at the knee. This is what's known as valgus, which means that the knees are caving in, right? And basically, if you look at the way they drew this, the ideal scenario, watch this, the ideal scenario is to have the knee looking like this, okay? So let's go back down here. But what you can see is that there's this angle like that, okay? Now, if you see somebody like that, well, obviously you're going to have to make corrections. So just keep in mind, this is an assessment. You're not teaching people how to do the squat correctly. You're simply doing an assessment. I mean, honestly, this doesn't take very long. You have them do maybe 4, maybe 5 squats, and you got it figured out. In fact, when you actually do this type of assessment, I used to do them all the time, is I literally take 1 or 2 squats. I can go bam, bam, perfect. And I'll tell them to continue. And I would just turn to the side, bam, bam, I'm done, 30 seconds or less. And I got it figured out. So the idea is that in the real world, if you're going to do this, don't be too concerned about it taking much time. It doesn't take any time at all. Literally, some people, 3 squats, maybe 5 total squats is going to be enough for you to get all of these down. What are the overactive? Okay, now look, if you don't know the TFL, the tensor fascia lata, the TFL, that's the muscle near the front of the hip. It's actually on the side. You've probably heard of of the TFL if you're looking at the lateral aspect of the thigh. So your iliotibial band, right? Your IT band. Well, your IT band is basically a big, massive, thick band of connective tissue. And the main or primary muscle that connects, now there's a number of muscles that connect to the IT band, with the gluteus maximus being one of them, but it's the TFL, the tensor fasciae lata. So it's really cool to say, but that's going to be your overactive muscle. Why? Because of, again, what is the kinesiological function? Write it down over and over and over and over again. And then your adductors. Normally, now look, you know that adduction or adduction is what pulls the legs together. So bringing the feet and legs from a position that's separated to bring them close. So basically, as you can see here, they are coming in. So they're being adducted. Abduction is when the legs move apart, right? Separate, right? Feet wide apart. That's hip abduction. When you bring the feet closer together and the thighs move closer together, that's hip adduction, adduction. Those are the inner thigh muscles. If those guys are working too hard, they're going to pull the knees in together. And you're going to see that when you do dynamic movements. What are the underactive? Look at that. Just go back. See, just go back. Whoop, gluteus maximus medius and gluteus maximus medius. Isn't that convenient? And gee, look at that. The anterior and posterior tibialis, anterior posterior tibialis. So when it comes to the overhead squat assessment, you got everything memorized from the first chart down to the second. Now we move to the Lphc, which is the what? The lumbar hip or lumbar pelvic hip complex, right? So that's right here, this guy right there. That's your Lphc. Now you're looking at the person from the side or the lateral, and all you're looking for is to see an overarching. I've got a little issue when it's simply just low back arches. In reality, the low back should arch. Obviously, there is a lordotic, there is a normal lordotic curve to the lower back. The question is how significant is that curve? Okay. When you have lordosis, you have this hyper sort of curve, hyper lordotic curve. So that hyper arching, well, that's again, this is in the real world. In the real world, I'm not too sure how much you can determine whether or not it's an unsafe or postural deviated arch, or it's a normal arch. Some people have a very strong arch, normal arch, when the erector spinae are contracted very tight. But for the sake of NASM and passing their exam, low back arches is your primary problem or issue that you're going to look for from the side. Now, remember, don't look over here anymore. When you're looking at somebody from the side, don't stop looking at the knee and stop looking at the ankle. You're looking at the hips. Okay. So what are going to be the overactive muscles? Well, now you're back to your memorization. So hip flexors, lumbar extensors, and your lats. Yes, I know some folks are going, what the heck does my back have to do with my lumbar? Everything, because your latissimus dorsi actually insert into relatively down low into the thoracic vertebrae. So when they are tight and you have your arm up in the air, you're putting increased tension on the latch during the assessment. And that could cause more or hyper kind of curvature in the lower back. Just memorize it. Just keep that in mind. All those muscles that we just talked about, other than hip flexors, but the lumbar extensors and the latissimus dorsi are on the back. So they're going to tend to, right, in this case, they're going to tend to increase that arch. Of course, the hip flexors are going to do what? Hip flexors are going to increase, they're going to increase this demand right here to flex the hips. So that's your overactive, your underactive. Now, if your overactive muscles are the hip flexors, more than likely your gluteus maximus is going to be underactive. It's, by the way, it's a really good idea to kind of remember that when in doubt, in general, the glutes are going to be underactive when we look at the overhead squat, the abdominals, of course, and then your hamstrings. Now, in this case, both your glutes and your hamstrings are going to be underactive. Okay, and the hamstrings, if they are underactive, that's because what is the antagonistic muscle to the hamstrings? Your rectus femoris, right? Your rectus femoris and your iliopsoas. So in this case, when you're looking at it from the side, the hamstrings are no longer an overactive like we saw previously. They're actually underactive in this case. And that's why you do the assessment. As you look, some people have overactive hamstrings. Well, the majority of people that I've ever dealt with have overactive hamstrings. Sometimes, though, depending on what you see, the hamstrings can be underactive, and they're kind of underactive in assistance with the gluteus maximus. So again, memorization of those actual muscles based on their kinesiological functions. I will say again that NASM did a really good job kind of putting this together to make it relatively easy to memorize. Again, from the side, this is another kind of issue, so to speak, that you may have when you're looking at when you're again looking at the Lphc, the torso from the side view. This can be a big issue, the excessive forward trunk lean. And the reason we say this is because for the most part, the average person that does a squat, and when they do an assessment, they're going to have a forward lean like this. Now, that's due to a number of different things. If we look at it from purely overactive, underactive muscles, now what are you doing? You're doing your memorization, but keep in mind the way you know that there's forward lean, and that's why they give you these. It's really important to look at the lower leg in line or out of line with the torso. Technically, the torso and the tibia fibula complex should be roughly parallel to each other, okay, which means that the foot and the ankle have to have a fair amount of dorsiflexion when they go down in position. So there's your femur, torso, femur, lower leg, roughly parallel to each other. That's kind of the idea, is that as long as these guys are parallel to each other, you're probably doing fine with the forward lean component. Finally, and by the way, actually, you can see it here. This is a perfect scenario. So you can see that, and that is roughly parallel. So she doesn't have an issue with the forward lean component, which is an issue generally with the muscles that we saw here listed with hip flexors, the gastroc too tight. See how the gastroc would be too tight, by the way, and that's why you're not getting the appropriate amount of dorsiflexion, right? Because the gastroc wants to plantar flex and keep that angle as close to 90 as possible. In the case of the again, lateral view, the arms falling forward component. Remember, it's the arm falling forward with respect to the angle of the torso, not the fact that your arms are coming forward because your torso is leaning forward. It's with respect to the shoulder joint. So if the arm comes forward with respect to the shoulder joint, in other words, the shoulder joint's getting pulled forward, that's going to be your issue. Generally, what we see here is that the lats, this is where the lats are the big issue. Sometimes the pec major and minor can also be pulling. Why? Because they're both internal rotators. Okay, just keep that in mind. And when you are in a overhead position, the pectoralis, which is actually a flexor at the shoulder, right? It flexes a shoulder. It actually wants to get that arm back down into a more appropriate position. So if they are overactive, they're going to assist the lats in trying to pull that arm back down into a arms fall forward position. Teres Major. You just got to memorize some of these muscles. Here is where folks generally have some issues, is with memorizing the underactive muscles, but don't be too concerned because it's basically all the muscles of the back and middle back. So your traps, your rhomboids, posterior delts, and portions of the rotator cuff. Okay, they're not going to tell you the supraspinatus, infraspinatus. Okay, they've already told you that the teres major, which is one of the rotator cuff muscles, is actually overactive. So it would be the supraspinatus, infraspinatus, and subscapularis. But you see, NASM was nice to you. They didn't give you those three names of the rotator cuff muscles. They just told you portions of the rotator cuff. So again, I'm hoping, as always the case, I'm hoping this is helpful because it gives you a little bit of information. I'm not going into it fully in depth because it take too much time. And we talk about it a little bit more in depth, of course, in a chapter by chapter study. Just keep in mind, Corey and I, we do a Q&A every Wednesday. You're more than welcome to come on board and ask us any questions you have about that. The weekly studies are designed to kind of get you thinking a little bit more about these subjects. Please remember to continue posting, as this one student did with the overhead squat assessment. Continue to post questions in there, and I can go ahead and do a study for you as well. If you have any questions, you reach out and contact us. Remember, the goal is to help you pass the NASM exam on the first attempt. Again, have a Merry Christmas, safe holidays. We'll see you next week. Thanks.